The Assistant Secretary of State for Health, António Lacerda Sales from Portugal, highlighted the new tools that enabled institutions and infrastructures to be prepared for more concerted, more inclusive, resilient, and sustainable responses, creating models of cooperation, partnerships, and reinforced strategic alliances. During the closing session of the Conference on Global Health, organized by the Portuguese Ministry of Health and the Directorate General for Health of the EU, he highlighted the role of the EU in the acquisition of personal protective equipment, masks, and ventilators, as well as the support of Portugal for health professionals, healthcare in other European countries as well. And if it is important to ensure that all countries have access to vaccines against COVID-19, it is also important to guarantee responses beyond the pandemic. If it is possible to mobilize for research under COVID-19, it will certainly also be possible to join efforts to combat malaria and other neglected tropical diseases. The strengthening of the EU's role in global health starts today, said António Lacerda Sales. António Lacerda Sales also highlighted the role of Portugal in the scope of international cooperation, namely with Portuguese-speaking countries. It was like that with Ebola, for example, and it is like that with COVID-19, with our bodies, Directorate General for Health, National Institute of Health, Dr. Richard Hoche and Instituto de Emergency Medica, guaranteeing cooperation on the ground. During the closing session, the Director General of Health, Graça Freitas, shared some of the main messages taken from the Conference on Global Health. I highlight global health and health diplomacy within the European Union, global health in Africa, and the importance of strategic partnerships and alliances in EU-Africa cooperation, she stressed. And she also pointed out the relevance of leaders in achieving universal health coverage, in minimizing the impact of climate change on health, and in the One Health approach, which is so relevant in responding to challenges such as resistance to antimicrobials, safety health, and the preparation for future pandemics, namely caused by vector-borne diseases. In line with the statements of the Director General of WHO, Tedros Ghebreyesus, who mentioned in the opening session that when health is at risk, everything is at risk, Graça Freitas referred that the health and well-being of people, supported by resilient health systems and the ability of countries to prevent, detect, and respond to cross-border health threats and natural disasters, have a significant impact on the economy, security, and development. And she also considered it necessary to understand the multisectoral nature of health for the effective adoption of health in all policies, and I would even say all policies in health. Throughout the day, the topic of cooperation was extensively addressed, namely with African countries, in particular in the panel on the theme Global Health and Africa. Magda Robalo, High Commissioner for COVID-19 in Guinea-Bissau, warned that it is not possible to return to normal after the pandemic with regard to EU-Africa relations. The relationship must be rethought and reformulated to include the recognition that Africa is Europe's closest neighbor. In the session on strategic alliances for the vaccination area, the Regional Director for Africa of the World Health Organization, the WHO, Matshidiso Moeti, highlighted the crucial role of the European Union in achieving the goals of the United Nations Sustainable Development Goals, and those are for 2030. The pandemic has demonstrated that health threats can paralyze lives and economies. Together, we can use this experience to secure greater funding for health at the continental and national levels. In this area of health, we can target each country's internal resources and define the priorities of European collaboration in order to make investments more horizontal and less fragmented. If we put the emphasis on equity, we will achieve more progress. In the field of vaccination, in the panel on the One Health approach, the director of the European Centre for Disease Control and Prevention, the ECDC, Andrea Amon chose the theme of disinformation, calling for the alignment of clinical guidelines at an international level. He called for a more proactive approach, recommending the use of reliable sources of information for people such as the European Vaccination Information Portal, which is an initiative of the EU, ECDC, and the European Medicines Agency. And that's a point with all what's going on with the vaccines at the moment. Please inform yourself properly before writing anything in social media, or there's so much nonsense going on. So please do that. And if you want to stay informed, please subscribe to my channel. Auf Wiedersehen.